Very good morning, everybody. Today I will discuss about the tests for accommodative stimulation and tests for the accommodative relaxation. Actually, this video is the continuation of my previous video about the clinical assessment of the accommodation. In clinical procedure in a routine optometry clinic, the tests for accommodative relaxation is done before the tests for accommodative stimulation because we need to relax any system before we stimulate it. Okay. So I will first discuss the tests for the accommodative relaxation, and this test is called as or also known as NRA. The word NRA stands for negative relative accommodation. So by this test, we actually check or measure how much amount the patient or person can relax his accommodation. Okay, so and it is a binocular procedure. Firstly, we instruct the patient to look at a 40 centimeter distance target, and then we add a trial frame on the patient's in front of the patient's eye, and then we add plus lenses binocularly, and we increase the power of the plus lens in 0.25 diopter steps until the patient reports that the target appears blurred, and this blurred should be first sustained blur. Okay, and the clinical significance of this NRA test is that the high NRA value indicates that the patient has accommodative insufficiency, and the lower NRA value indicates that the patient has accommodative excess. The normal value for the NRA test is near about plus 1.75 diopter. Okay. Next come to the tests for the accommodative stimulation. This test also known as the PRA test. The PRA stands for positive relative accommodation, and this test is done to check how much amount the patient can stimulate his or her accommodation. Okay, and this is again a binocular procedure, and firstly we instruct the patient to look at a 40 centimeter distance target, and then after putting the trial frame we add minus lenses binocularly and increase its power in 0.25 diopter steps until the patient reports for sustained blur. And what is the clinical significance of this PRA test? The high PRA value indicates that the patient has accommodative excess, and the low PRA value indicates that patients may have accommodative insufficiency. The normal PRA value is minus 2.25 diopters. Okay, so this is all about the NRA and PRA tests. Thank you for viewing.